and welcome to the anchor session of CME Palooza Fall 2019. I am Scott Kober, your co-producer of CME Palooza, and I would like to welcome you to this session that is entitled The Great Big Play at Home in Your Jammies CME Quiz. This session is sponsored by Infograph Ed. Our moderator for this session is Karen Overstreet, the principal at Nexus Continuing Healthcare Education. So before we begin with this session, a few housekeeping items. As with all of our broadcasts, we will first want to recognize our sponsors. So our gold sponsors, Academic CME and Med Learning Group. Our silver sponsors, ASIM, Creative Educational Concepts, Global Education Group, Haymarket Medical Education, Infograph Ed, Medscape Education, Physicians Education Resource, and Prova Education. And finally, our many bronze sponsors, Answers in CME, Academy for Continued Healthcare Learning, Antidote Education Group, Catalyst Medical Education, Clinical Care Options, CMEology, Global Academy for Medical Education, Helio.com Education Lab, Integrity Continuing Education, Integritas Communications, Peer Audience, Postgraduate Institute for Medicine, Primary Care Network, Paradigm Medical Communications, PVI, Red Med Ed, RMEI, and Vindico Medical Education. So thank you to everyone who did sponsor CME Palooza this year. So a quick note about speaker disclosures. Please note that the opinions, discussions, and or conclusions expressed are those of our panelists and do not represent an endorsement by or position of their employer, its parent company, or affiliates. So we're going to go over the rules for this session here in a little bit, but before we do, I am going to turn it over to Karen Overstreet, our moderator, who will help introduce our panelists for this session.
Thank you so much, Scott. Good afternoon, everyone. Thank you for being guinea pigs with us for this first lightning round quiz session. All of my co-presenters and I are very excited about the session and looking forward to a fun 45 minutes or so. This was a very iterative, dynamic process to put these questions together. We had numerous conference calls and wrote and rewrote and revised the questions over a couple of months. So we hope that turned out well, and it's always a wonderful learning experience to participate in developing questions like this. If you ever have the opportunity to write questions for a program like this or for a certification exam, please take that opportunity. It's one of the best learning experiences I've ever had. As Scott mentioned, I am with Nexus Healthcare Continuing Education Consulting. So I'm doing consulting and volunteer work while I am actively looking for a full-time role, hint, hint. As we introduce the other panelists, we thought we would do something a little bit different today. And in addition to saying who we are and what we do, we let you know if we weren't spending our careers in continuing education, what we would like to do. So if I weren't a CME professional, I would love to be the winner of So You Think You Can Dance, and also a best-selling novelist. Neither one of those are, well, maybe I'll be a novelist at this point in my life. We'll see. I'll turn it at this point over to our outcomes guru, Derek Dietz.
Hi, great to be with you today. So Derek Dietz, I am the president of Metrics for Learning. And if I wasn't in this current profession, I would want to be either a prison chaplain, because of my work in that ministry, or I would enjoy working for a local nonprofit.
Thanks, Derek. And next is Sue McGinnis.
Hi, everyone. Sue McGinnis here. I work within the Medical Education Grants Office at AstraZeneca. If I weren't in CME, I have very lofty goals. I would be a professional napper, one. Or I would be a philanthropist, two, or realistically, I would probably go back to school to be a counselor.
Great, thank you,
so I could help
Sue.
myself first, I think.
Thanks, Sue. And that brings us to Ann Perch.
Oh, hi. I'm Ann Perch. I'm the Senior Associate Director of the Office of CME at Baylor College of Medicine in Houston, Texas. If I was not doing CME, I would probably want to be a professional chef, and maybe a professional traveler, like a travel writer.
Great, thank you, Ann. And next is Ann Simmons. She gets the prize for calling in from the farthest distance today. Ann is joining us from Portugal.
Hi, everybody. It's a pleasure to be with you. Technology is just amazing and wonderful. I am the founder and principal of Accreditation and Outcomes Solutions. We are a company that helps organizations to get and stay accredited, specifically helping organizations to write their self-study for reaccreditation. If I were not in CME, I would return to my roots. When I was 11, I did an internship as the tooth fairy, and I was very good at it. And I would do that for the rest of my life if I could.
That's great. Thanks, Ann. And Scott, we'll turn it back to you for the instructions for the game.
Okay.
Hey, well, wait a second, Scott. If you were in CME, what would you be doing?
Oh my goodness. See, you guys had time to think about this. If I was not in CME, what would I be doing? I'll come back to it. Let me think about it while we're kind of going through that.
That wasn't fair.
Okay. So here are the rules for how to play in this session's quiz. So you will need to utilize the Poll Everywhere platform to compete. I know Derek has been calling it the Polls Everywhere platform. It's very annoying that he's been getting it wrong all these years. It is the Poll Everywhere platform. So you can either download the Poll Everywhere app and join the presentation entitled CME Palooza, or you can type in the following URL in your web browser. It's www.polleverywhere.com/CME Palooza. For people who were in the last session, our Jake Power session, the URL is exactly the same. So you can just go and participate and play using that same URL. So there will be 20 questions in this session. So speed counts. The quicker you correctly answer a question, the more points you will get. This is a competition. There's a very short tape delay with the broadcast, so please watch your phone and device carefully. Questions will likely pop up there before they appear on screen, although it seemed pretty well synced in the last session, so it shouldn't be too much of a difference. You will have 30 seconds to answer every question. Once you answer your question, you cannot change your answer. So we're not letting, so once you kind of key in what you think the response in, that you are locked into that response. After each question, there will be a leaderboard kind of showing who is, as I said, in the lead for that session. So we do have prizes for this session. Our first place winner will get $250. Our second place winner, $150. And our third place winner will get $100. And I would like to thank our prize sponsor, Medscape Education, for providing the prize money for this session. So with that, I am going to call up the questions here in just 1 second. It's a different screen that I've got to share. So let me find this screen. Okay. And oops. Let me get this to call up and to play in the big screen. And Karen, just give me a verbal cue when you guys are ready to go with the first question.
We're ready to go, Scott.
Okay, hopefully everyone is logged in and ready to play. So here we go.
So question number 1, let's assume that you're getting ready to take the CHCP exam, if you haven't already, and you want to enhance your skills about adult learning theory. So one of your colleagues who recently took the exam recommends that you review the work of Malcolm Knowles. So you discover that based on Malcolm Knowles' work, that children learn differently from adults. So specifically, you learn that in contrast to how children learn, adults learn by one of the following ways. Options, please. So are they subject-centered, Do they want to understand why they need to learn? Are they motivated externally, or do they rely on how the educators deliver the education to them? Great, lots of smart folks participating this afternoon. We will go back after the 20 questions and discuss any of the questions where a lot of people get the incorrect answer. And of course, you can submit questions to us anytime. We'll come back to those at the end of the questions. Question 2, Scott.
Well, we'll first show our leaderboard. Okay, here are our leaders. So this will show after every question.
Next question. So building on what you learned about how children learn, you want to find out more about specifically how physicians learn. So which of the following behavior change models focuses on strategies that individuals negotiate to make sustained improvements? 4 models are listed here: the pre-seed model, the theory of planned behavior, the trans-theoretical model, or the COM-B model.
Okay.
Interesting.
And the leaderboard.
Okay, here's our leaderboard. So TH is still in the lead.
Way to go, TH.
with a couple of folks not too far behind. Question number 3. We've learned a lot about how clinicians adopt innovations in their practices. There are things that we know that they typically do early in that process and late in the adoption process. So for the conclusion of the adoption process, which of the following items is dependent in order for clinicians to adopt a change in practice? Communicating with local specialists, review of trial results in medical journals, participating in CE activities, or reviewing updated practice guidelines.
See, it's too bad that none of you said that you wanted to be an American Idol finalist, or else I would have you sing a song during the last sections of this.
Well, we should be singing to distract people, right? This is for money.
It is for money. Okay.
Another interesting answer. Very good.
Okay. So here's our leaderboard. Let's see if anything's changed.
Ooh,
Susan Y has taken the lead.
Ooh.
Okay,
Go,
it's still
Susan.
very, very early. Still very early.
Go, Susan. Last of my questions. There are numerous things that support clinicians' motivation to participate in self-directed learning, or as we heard from Lawrence Sherman earlier today, maybe that should be directed self-learning. But which of these factors relates directly to an individual's view of his or her capability to successfully execute a specific task? Forethought, curiosity, critical thinking, or self-efficacy?
Okay.
Much better response on this one.
And here's our leaderboard.
Oh,
Very,
Uh-oh.
very close.
Nelson. No.
Very close. Very close. Okay. Let's move on to question number 5.
Question number 5 is, these next 4 are by Ann P.
Hi there. Okay, so the 4 key stakeholders of a healthcare system, sometimes known as the 4 Ps, are patients, providers, payers, and policymakers. The role of the policymaker is to establish the framework within which healthcare is provided, define the direction of research and development, work to eliminate instances of fraud and abuse, or conduct and support health promotion, prevention, and preparedness.
Okay.
Good.
Still
Ooh.
still very close first, second, and third.
It's like the top 3 there.
Okay, next question.
Okay, so the following questions are going to be based on this case. The case here is that a QI project is being implemented at your hospital, and the goal is to reduce the percentage of patients receiving an opioid prescription at the time of discharge. The Chief Quality Officer asks you as the CME provider to certify this project. The first question is going to be, what info is needed to start this project? You're going to need medical record numbers of patients, number of opioid prescriptions written, names of physicians responsible for the process, or average dosage prescribed. Okay.
Great response there.
Yep.
Okay, Susan Y has retaken the lead.
GH is hanging in.
Okay, second question based on the same case. The participants of this project, they receive a report on their opioid prescribing patterns along with peer comparison graphs. They are then asked to develop an individualized improvement plan. 1 month later, they get an updated report. These are physician participants in this project. What type of intervention is this? Problem-based learning, educational outreach, clinical reminders, or audit and feedback?
Okay. Very good.
Very good. Oh.
All right.
It's a tough race.
I know, it's tight. And the last question related to this case is one key stakeholder that should be brought in early and is necessary to this project's success is the Pharmacy and Therapeutics Committee, the Clinical Decision Support Department, hospital administration, or medical staff services.
So just remember,
Even the song right here.
yeah, so for everyone playing, remember that it's not only getting the question right, but how quickly you get the question right. But if you get the question wrong quickly, it's 0 points.
Okay.
All right, a new leader.
Ooh, Allison.
All All right.
And now we're to Ann S's questions.
This question is about learning in a simulation lab. Per the ACCME, what is the highest level outcome that may be measured immediately following the simulation learning activity? Knowledge, competence, performance, or patient outcomes?
So for those people who are scratching their heads and wondering why a certain answer was correct, we will both be going over certain ones of these questions once the quiz is over, but the full rationale will be posted on the CME Palooza website as soon as this session is over as well, so you can read through all the correct responses.
Ooh.
Okay.
Interesting.
TH is back on top.
Okay. Okay, so this is question 10. So this is the halfway point.
A specialty society has invited one of their world-famous members to give a presentation at their annual meeting. This world-famous expert is to discuss their research, which led to a new disease treatment. The expert's disclosure revealed that he patented a device used to deliver the treatment, and he is the primary shareholder of the company who will manufacture the device. The planners discuss the following options and agree on the option that will comply with the ACCME standards for commercial support. And those options are: ask for the speaker's PowerPoint slides and send them to the peer review committee for approval. Limit the expert's content to the research that led to the new treatment. Require the expert to disclose her relationships to the audience before giving the presentation. Or the last one, withdraw the invitation because the speaker is an owner of a commercial interest whose product relates to the clinical area being discussed.
Okay, good.
Very nice.
Right. Question 11.
A planning committee for a series on chest pain has a member who has disclosed that she is an advisor / consultant to a company that manufactures heart catheters. The committee discusses several methods of resolving the conflict of interest of the planner. Which of the following options is in compliance with the ACCME standards for commercial support? Planner recuses herself from any discussion or planning in the area of interventional cardiac procedures. Recusal is documented in the meeting minutes. Next answer, the conflicted planner is told to recuse from any planning having to do with the diagnosis or treatment of heart disease. Next answer, the conflicted planner signs an attestation saying that she will not show any bias or product promotion while serving on the planning committee. And the final option, the non-conflicted planner watches for and calls out any bias or promotion of the conflicted planner. This is documented in the meeting minutes when it occurs.
Okay. All right. Allison back in the lead. Okay. Next question.
The CME committee wants to offer a conference on the therapeutic uses of cannabis and cannabinoids. Which of the following uses of cannabis / cannabinoids cannot be certified for credit? Chronic pain treatments in adult. Improve multiple sclerosis spasticity symptoms. Reduce asthma development or asthma exacerbation. Reduction of chemotherapy-induced nausea and vomiting.
Okay.
Wow.
How about
right.
that,
All right.
my friends? Well done.
Okay.
Wow.
So we have 2 more sections left. So this is question 13.
Sue.
All right. A provider receives a grant for a certified live symposium, an enduring activity, and a waiting room poster. And the poster is valued at less than $10. A buffet meal will be offered before the symposium. So according to the CMS's open payments FAQs, which items are reportable? The honoraria for the faculty educators, the meal at the symposium, the patient waiting room poster, or no items are reportable.
Ready?
Okay. Present.
Good job.
Still very close to the top.
So according to the CMS open payments FAQs, when are meals, snacks, or coffee for physician attendees reportable? Meal, snacks, and coffee are reportable under all circumstances. Live activities other than large conferences, meaning grand rounds, local, regional meetings. Live activities where the identity of the physician attendee is known. And lastly, live activities where the identity of the physician attendees who consume food and beverage is known.
Very good.
Great work, everyone.
Ooh.
TH is back.
Oh, wow.
Hi.
You're welcome, TH.
Question 15.
CME Palooza University received grant funding from Cobra Pharma to execute a series of certified grand rounds. At the end of the series, the CME office realized that there was money left to execute 2 more programs. The next step for the CME office is to consult with the letter of agreement for contractual obligations, convene a meeting with the planning team to determine next steps, refer to the ACCME standards for commercial support for guidance, reach out to the faculty to gauge his or her interest and capacity, or schedule the 2 activities.
And please, no one send any grant requests to Cobra Pharma. Our budget is completely used up in the air,
But you'll have more money in January?
perhaps.
I was hoping I'd get a chuckle out of you.
Uh-huh. Okay, great. Right.
TH knows his open payments, knows his LOAs. Okay, so according to an article published in the Almanac, worst practices for writing CME needs assessments results from a survey of practitioners. The most common poor practices are related to plagiarism, fabrication, or bias, insufficient sources and sloppy referencing, irrelevant or poor focus, organization, coherence, and readability.
Okay.
Oh.
Right. All right. TH still in the lead. Remember, top 3 places get prizes. So keep at it. So this is, now we're into the last section. These are the last 4 questions.
Take it away, Derek.
Okay, so TH, Allison, Amber, Susan Y, CS, here you go. Be up there. So you've collected paired pre-post answers to 5 multiple choice knowledge questions for 47 learners. And what statistical test should you use to calculate a p-value for the difference in correct answers from pre to post for each one of the 5 questions? The chi-square test, Fisher's exact, McNemar's, or the t-test?
I'm convinced you just made up some of these names, Derek.
Some people say, oh, it's kind of like Likert or Likert.
Right. Okay.
Ooh, interesting.
Okay.
Just like you thought, Derek.
Not much of a change. Everybody got it wrong.
Boo, Derek.
Okay, so you have collected skewed paired pre-post answers to 5 confidence questions for 47 learners. And the scale is 1, not at all confident, to 5, extremely confident, and 6 is not applicable for me. What do you need to do before calculating mean pre and post ratings for these data? And the options are nothing at all, remove the 6 data, replace the 6 data with a 0, or scrap it. Scrap the data. You should have started with a 0 in your scale, not a 1. Good job.
A little better.
Excellent.
Ooh.
Allison's back on top.
Okay, very close for third place. 2 more questions.
So as defined by Moore, Green, and Gallus in 2009, results of pre-post confidence rating scale results. Results of pre-post rating confidence rating scale questions represent what outcome level? Is it 3B, learning procedural knowledge, competence, level 4, performance, level 5, or no level was defined?
Okay.
Ooh.
I think that's the lowest one yet.
Yep.
Yep.
Ooh, and PCAP moves into third with 1 final question.
Oh, way to go.
Okay.
From a question design standpoint, what, if anything, is wrong with this question and answer choices? A lot of options here. The stem is negatively worded. There are too many response options. It uses combination answers, only A and B, only B and F. The various options for answering the questions are of different lengths. All of the above or none of the above?
I had to read this question about 10 times with an unlimited amount of time to figure it out. Okay.
Yay!
All right. So before I hit the button for the final results, do we want to do a virtual drum roll?
Yeah. Yep.
Okay, here we go.
Allison.
Woo!
Allison is our winner.
Yay.
TH finishes second. Susan
Congratulations.
Y
Came back.
third.
Yay.
So
Great job, everyone.
So congratulations to everyone. And for our winners, hold on one second. let me call something up here. Since I do not know who you are, please send me an email. My email address is here on the screen. You can also find it on the CME Palooza website. Send me an email with your just information, and I'll get back to you, and we'll figure out if you want to be paid via check, via PayPal, Venmo, Amazon gift card. It's really going to be up to you. So just shoot me an email and we'll figure that out. So now we are going to, I'll turn it back over to Karen for sort of the second half of this session where we're going to talk about some of these questions in more depth.
Yeah, thanks, Scott, and congratulations to the winners, and thanks for everyone for playing along with us today. Derek, why don't we start with your questions 17 and 19? I believe those had the lowest correct responses of any in our 20 question set. And just as a reminder, as Scott said, after the session, you will be able to download a handout that includes the question, the correct answer, which of the Alliance's national learning competencies the question aligns with, one or more references, and also a brief rationale.
Okay. So this is a question about what kind of what kind of statistical test you want to calculate a p-value. The key here is that it's paired data. And so paired data requires a different test than chi-square. So these are multiple choice knowledge questions. It's either correct or incorrect for each person. And so the McNemar test is the correct answer here. If it was unpaired data, then the test would be the chi-square test. Fisher's exact is used for in smaller sample settings. It would take more time to describe that. And the t-test has two versions, paired and unpaired, which can be used when you have a score for each learner. For instance, 8 out of 10 answers correct. And some people pronounce it McNemar or McNemar or McNamar, but choose one. Question 19. So as defined in this seminal article that we all have used over many years, the one from 2009, confidence was not given a level. But I like your answer that competence is where you would place this. That's where I would place it too. It wasn't assigned a level, and like you, my personal preference is that it seems to be that confidence is a measure related to competence, precursor to performance change.
Yeah, and Derek, in the updated version of the article, and Lawrence Sherman mentioned it earlier today, if you were in that session, Lawrence didn't mention that he and Kathy Chappell were two of the authors on Don Moore's updated article. Confidence wasn't mentioned there either, was it?
Right. I could not find it in that article either.
But I think that the consensus among all of the panelists for this session was that it fits most comfortably in competence.
Yeah.
Thanks, Derek. Scott, have there been any questions submitted for us, or should we continue?
Not yet. Yeah. Why don't you keep going on with some of these, and I'll see if there are any questions that kind of come up.
Okay, I will take a couple of minutes to go over questions 2 and 3. There were some low response rates to those. Question 2 dealt with different models that explain how physicians learn. And I'm guessing that the results here were just based on folks guessing. The pre-seed model deals with factors that predispose, enable, and reinforce learning. That is a concept that's discussed in both of Don Moore's articles that we've been hearing so much about. The theory of planned behavior deals with how individuals' intention to change or intention to adapt what they learn is influenced by a number of factors, including the attitudes of others and their perceptions of their own abilities to change. The correct answer, the trans-theoretical model, is also known as the Prochaska model. I would imagine most of us are fairly familiar with that. That deals with stages that individuals go through when they're preparing to change. And finally, the COM-B model, another of the incorrect answers, deals with factors that influence behavior change based on an individual's capability, their opportunity for change, and their own motivation for change. Moving on to question number 3. This deals with the adoption cycle and things that clinicians typically do early in the adoption cycle versus late in the cycle. And a number of research studies have shown that typically physicians engage in reading data and participating in CE activities earlier in that adoption process. But in order to make what they learn sticky, in order for them to really integrate it into their practice, they need communication with local experts, with peers in their local communities who are the champions or the leaders in that therapeutic area. So I hope that helps with those couple of questions. Why don't we next take Ann Perch? The stakeholder question number 8 had a fairly low response rate. Would you mind commenting on that one?
Sure, Karen, thanks. So the correct answer here is clinical decision support, the department itself. Clinical decision support, their role is to compile reports of patient lists and prescribing actions. This department is able to provide person-specific information that's filtered or presented based on specific times to help inform decision-making. So having clinical decision support in your project early is really about being able to get the data you need out to perform that audit and feedback function, and how it's getting pulled across many sources of data. Many of you responded with hospital administration, and oftentimes they serve as the champion around a project like this in order to move it forward. But from a direct impact perspective, clinical decision support is more the role, the people that you need on the ground to get the project done. Pharmacy and Therapeutic Committee, it's about drug formulary for the institution, and data coming out of a project such as this may inform this committee further down the line, but doesn't have direct impact on this project. And medical staff services is responsible for coordinating credentialing processes and really maintaining databases of physician information. So they may be the ones who will know which physicians may be appropriate, but by the time a project of this scope is already defined, you already know who your audience is, the participants are, and decision support then is able to align and pull the individual physician participants and their prescribing pattern.
Great, thanks, Ann. And Ann Simmons, would you mind commenting on question number 9, the one about the simulation lab?
Sure. This is a very challenging question, and we discussed this thoroughly as a group before we put this on here. This is a challenge within our profession. The definitions of competence and performance vary depending on who you talk to. So a key phrase in this question was per the ACCME. And per the ACCME, competence means acquiring or sharpening skills or strategies. Performance is what you do in the patient care setting, actions taken in treating and caring for patients. So in this situation, we have A sim lab has a mannequin that has a heartbeat, a respiratory rate, temperature functions, as lifelike as we can get without actually being lifelike. So the answer to this question is the highest level that you can measure is competence, because what you're measuring is the acquisition and sharpening of skills and strategies of the learner. However, they are not in the patient care setting. They don't have the same consequences. If the heartbeat of the mannequin stops, it's certainly not the same as the heartbeat of the patient stopping. So that's the difference between competence and performance in this particular question. But it is challenging, and we recognize that. It was not meant as a trick question, but we wanted you to know and be aware that within our profession, we need to continue having this dialogue about what do those terms mean, and who, based on your organization or based on the funder or the supporter or based on the ACCME, who is going to define these terms?
Excellent point. Thanks, Anne.
So Karen, we have one comment that came in, and then one question.
Okay, great.
So let me go through these now. So Derek, I think this refers to one of your questions. So this person is saying that reading more Green and Gals from 2009, pre-post test is level 3. I would say knows how, which is essentially knowledge. For competence, a participant would have to show how to do the new thing, not just know how.
Yeah, let me pull out my questions again.
And so while Derek's doing that, here's a question. This is a question that came in, and really anybody can
It's
respond.
question 19, Scott.
Yeah. So I'll call it up, and then the question that everybody can think about is how representative are the questions in this quiz of what one would see on the CHCP exam?
I will take a first stab at that. Ann S. and I are both part of the CHCP commission. So we were involved in exam development, so we can't say anything about what the content is. We signed a confidentiality agreement. Perhaps Ann P. or Sue or Derek would like to comment, but I can say that we developed these questions using a similar process to the way that exam was developed. With two exceptions here, with the exception of 2 of these 20 questions, we wrote these using established best practices in item writing. 2 of the questions, the last one most notably, we made the decision to deviate from that. So, the questions reflect the national learning competencies of the Alliance, as do the CHCP exam questions, and that's basically all I can say about it. Derek, Sue, or Ann P., would you like to share any comments on how you think these questions might relate to the exam?
Well, I wrote some questions that I'm not sure.
Oh,
if
you're
any
precluded
of my
as well.
Yes, I don't know if any of my questions made it into the exam, but I will tell you that to your point about the process of going through and writing questions for the exam, I definitely used when I was creating my questions. So it's a model.
I can say that these questions are really similar to the exam questions. The rigor of the answers and the possibilities. It's not intended to be a trick question, and this process represents that same process that we went through here. But the possible answers are aligned and kind of close, and you really have to really consider your options and study that question. But from a categorical standpoint, yeah, it very much does hit on those similar exam questions.
Yeah, and Scott, was the person who asked the question about the Moore et al. Article, were they asserting that confidence would be a level B type measure? Is that what they were asserting?
I read you exactly what they wrote. So beyond that, I have very little to read into it further.
Okay. Well, I've been told before I'm entitled to my own incorrect opinion. But I do feel like confidence or self-efficacy measurement that I've been doing for many years falls into the competence category. Others may feel differently, and that's just fine. It does not appear that a formal, this has been formally addressed in the literature.
Okay.
So again, to reiterate the point that Ann Simmons made earlier, it's important to know whatever project you're working on, whoever your partners are, what are the definitions that that team is using to avoid having some issues such as this one.
Okay. Any other questions you want to go over before we wrap this up, Karen?
Since we have just a couple of minutes, Sue, would you mind commenting on question 16? It was the one dealing with the worst practices in needs assessments. And from your unique perspective as a supporter, do you agree with what this survey showed, or what are your personal perspectives?
Sorry. So my interest in this was because I was on a panel at the recent CBI, and we talked about what goes into a good needs assessment. And so doing my research for that, I found this article. And I don't think this article doesn't address all the different sources that we should be pulling from when needs assessments are being drafted, executed, considered. I think for here, though, what I did find interesting is in the discussion of the article, they said that people knew what they wanted to say, but they couldn't find the right sources, and they were very sloppy in referencing. I thought the referencing part was kind of interesting because there's so many programs we can use for that. But I found the insufficient sources very true, because I think that's what I find as well. Like, I want to say something to build my case, but it's not there in the literature. We kind of know it's Gestalt. But I think what's interesting about this is typically this is the first article or the first survey that they did looking for the worst practices. Normally they do this survey every year for best practices.
Yeah, it was interesting that the researchers took the opposite approach this time, and it was great that they published it both in the Almanac, but also in the American Medical Writers Association journal. And both of those references are listed in the handout that you can download after the session.
Okay. All right, great. Well, I am going to first of all, let me thank all the panelists for their participation in this session. I would like to thank, you guys worked very hard on these questions. So thank you to Karen and to Ann and Sue and to Derek. I'm going to minimize the 5 of you so I can unfortunately have to bring Derek up onto the end of this broadcast, that we can wrap up CME Palooza Fall 2019. Yeah, all of our panelists had no technology issues.
No, just the 2 losers.
Yeah, it's funny how that happens. So I want to thank everyone thank all our panelists, thank our audience, thank everybody who played. I already got emails from our 3 winners from this session. Ooh. So I will be responding.
Was one of them me?
Shortly. No, it was last place. Did not get a prize. Maybe next year.
Maybe next year. There's always next year.
Any closing comments you want to add in here, Mr. Warnick?
Not too much. I was a little behind on getting the archive stuff up because of all of the technical issues that I was having on my side. So I'll get them up shortly. So that'll be up soon. I'm in the process right now.
And for those people who want to listen to podcasts of these, how long are they going to have to wait?
I don't know. I'll do it when I can. How many people really want to listen to the podcast? Maybe a lot. I don't know.
Okay, I guess we'll see.
We'll see. I will put something on the blog.
Okay. All right.
Otherwise, no. I thought it went pretty well besides our stupid issues. But everyone else did great.
So for people who haven't yet completed the survey, we always ask people to complete the post-activity survey. So it's on the live page. There's a link on there. Otherwise, we will sign off and see you guys again sometime next spring. Bye, everyone.
Bye, everyone.